Hello, everyone. Thanks for joining us. You'll have to forgive me and Anna if we look a little rushed today. We've actually been dealing with breaking news right up until this started, so bear with us. Welcome to Beyond the Headlines. This is the first of these that will be held in Greenville. It's a Post and Courier series. It's being done across the state. You can go check out our website and see previous editions, but happy to bring it to the upstate. Anna and I are going to be talking a little bit about our coverage of education, particularly Greenville County schools, and the way they've dealt with COVID-19 and some of the things that have gone on this year. Before we get started, I'd be remiss if I didn't mention, if you're not familiar with us, to be sure to check out our website, postandcourier.com/Greenville. We also have an app for both iPhone and Android. We're on Twitter, Facebook, etc. And do also please sign up for our newsletters. Just a quick plug for our coverage there. If you follow those things, you'll stay up to date. Again, we're going to be talking a little bit about education today. And we have a handful of pre-submitted questions that you sent in. We're going to cover those as best we can. If you have questions throughout this, please drop them into the Q&A box, and we will do our best to answer as many as possible. I will honestly tell you, though, we have more questions than we could conceivably get to. So we will do our very best, Anna and I. Before we get started, though, Anna, we have some breaking news on the education front this morning. Can you tell us a little bit about what you have been working on so far today?
Yeah, we get a lot of tips from various people in the community, whether it be through Facebook or email. People call me, my phone number is out there. And we got a tip this morning that an attendance clerk at Gilchrest High School might have gotten COVID and passed away. We have not gotten confirmation directly from the school district on that point, but what the school district did tell us, and this is just within the last 15 or 20 minutes, was that 3 staff members in the district have passed away this year, and from COVID-19. There are 10,000 people or so, roughly work for the school district, so we have to always keep this in perspective. But that's the first time we'd heard. They don't, I don't think as a rule, make a general announcement when people die, and obviously there's a lot of interest around coronavirus. So I have to be a little careful about how I speak about the Gilchrest High School situation, but we had gotten some tips, and we did make a connection there.
Yeah, and I should note that we were dealing with that right up until the time that we jumped on this. We actually just recently published a story about the 3 school-related deaths that the school system reported today. We were having conversations about this up to about 5 minutes ago, Anna. And we have made a specific choice not to release the name that we had heard at Gilchrest right now. Just in case anyone wonders about that, we do have a lot of very specific discussions about how to release that information and trying to respect their privacy. Regardless, we do extend our condolences to those affected. I know particularly out at the school and the school system as a whole, they're dealing with this today, and we do understand that's a difficult time. So we did want to cover that right up front, since we were dealing with that right before we got on camera. But I know most of this is to take a look at the reporting that we've done over the last several months as the school system has grappled with how to deal with COVID, and as parents and teachers and school board members have grappled with the right way to go about this. And clearly there's a wide range of opinions. That's definitely evident in the questions we've gotten. But Anna, just to sort of set the stage for what we're going to talk about the rest of today, can you do a quick recap of kind of the school year, where we started back in July and August, and where it stands now?
I mean, I can even go before that. I was working for another newspaper in town back in March when the news broke that the governor was going to shut down schools statewide. We all remember that day. That was a hair-raising day, rushing to get that report out. And I was actually in quarantine at the time because I'd been at a big reporter conference, and it was anyway. So I was at home, but then the school district had to quickly, of course, pivot and figure out how are we going to educate these kids for the rest of the year. And then, oh my gosh, this thing is still hanging around. What are we going to do in the fall? So y'all probably recall, whoever's watching this, we've got over 60 people, it looks like, watching this. You'll remember the surveys went out. You know, the school district was trying to figure out, what do we do? What do parents want? They ended up setting up a virtual academy, and they came up with an attendance plan that would monitor community spread of coronavirus and reduce the number of days in person at school accordingly. Of course, we know that was what was released in July. Parents were able to make a decision at that point whether they wanted to go full virtual with their kids and keep them at home, or go ahead and have them in school at least part of the week, depending on spread. That gradually changed, as we all know. The school district was able, because, oh my gosh, I can't even remember. I don't have the stats in front of me, but a huge chunk of the student body ended up staying in the virtual academy, which opened up literally physical space within school buildings so that more kids, so that more days of in-person could take place potentially. This is most acutely seen, if you will, in the elementary level, where there are smaller school size, class sizes anyway. And you had schools where 40% of the kids were in virtual academy. So you've just got fewer kids in the building. So they were able to pretty quickly, within a couple of months, have elementary school kids attending 5 days a week. And they enhanced that with plexiglass and stuff like that. But what you started to see there was that it wasn't just about community spread of coronavirus that was necessarily driving some of these decisions. You know, they were talking about keeping safety protocols in the schools as well. So can we keep the kids distance? Can we keep a mask, you know? And then we add the plexiglass, and now we can just get by with just a 3-foot distance. So they were going with the science, you know, and we've heard that from Dr. Fauci too on a national level. We let science drive the discussion. So they did start off the year looking at just community spread, and then they gradually changed it. The most dramatic change in terms of how the school district is handling attendance is on December 8th, when the school board voted unanimously to cede all control of attendance plans to Superintendent Burke Royster. So that's been the case for a couple of months now, that he calls the shots, period. He does have a very stout support staff that informs him. They are constantly reaching out to public health officials and stuff to get the best advice, but we saw that could go a little bit sideways too. We reported on that because they were getting advice from the hospital systems on whether and how to open, but it didn't always get written down. So when we put in a FOIA request saying, hey, what did they tell you? Y'all might recall we reported that, well, there was a letter that, well, I'm going off on a tangent here, but there was a notification sent to parents ahead of school reopening in January after the winter break. You know, there's that 2-week break, and that letter said, we are being advised that it's actually better for the community and will help mitigate community spread if these kids are in school 8 hours a day following rules. We never could find any piece of paper that confirmed that Prisma or Bon Secours was saying such things. And there it stands, you know. So yeah, so I think, and they actually told me quietly and said, well, we're going to document everything from now on because we didn't have it in writing, but we know that they said that. So, you know, it's a he said, she said situation. But that's been the school year. Here we are now, and high schools are at 75% attendance. Elementary and middle school are at full attendance. I've got a daughter in middle school. She goes every day. And I can talk a little bit about that, about what she sees and reports back to her mama. But they are doing their best to keep the kids separated during the day. I'm gonna let you ask another question, Ryan, because
Sure, yeah. So one of the things I think caused maybe some confusion for some folks, and frankly, you and I have discussed it a few times as well. You know, as you mentioned, sort of early on, before the school year started, there was a talk about we'll continue to put kids in school unless community spread increases, in which case we'll bring it back. And you know, we know COVID is a constantly evolving thing, right? We know a lot more now than we did in March. We don't know as much now as we will 6 or 8 or 9 months from now, but it was a pretty strong statement. And of course, that's changed significantly. I know you talked to some of the communications folks at the school system this week, and had a pretty clear explanation from them on what the threshold is. Can you talk a little bit about that?
Yeah, we had a wonderful question from the community to that effect. What threshold, what will trigger reducing the number of days in person? And Terry Brinkman, who is their communications director, she said, and she basically reminded me, they've never come out and said this, but she kind of reminded me that Dr. Royster is always referring to what he calls the risk ratio. And basically what that means is if there are more cases within the school system, if the per 100,000, if that number is elevated above the per 100,000 number in the community, they will start looking at shutting down schools, individual schools, the whole district, maybe individual grades. You know, I've never heard of any grade or school or class getting shut down. And maybe if there is anyone out in the community who has, let me know. But to date, they haven't had to, because it just hasn't ever been a situation where they haven't had enough staff to keep the kids supervised. And in general, the infection rate just has never gotten to that level of the community. So what we're talking about is total number of cases over the past 2 weeks per 100,000 population. And I looked at the calculation as of this morning, and we are looking at 810 cases per 100,000 inside the school system, you know, right now. And in Greenville County, it's 1,043. So you can see how the school district is lower than the community. Now, we have some very clever data people in the community who have pointed out that the denominator that they use to come up with that per 100,000, they use 84,877. So that's staff and students combined. And then they kind of, you know, elevate that up to the 100,000 to come up with their rate per 100,000. This particular data person who's out there says that 84,877 is way too high, but actually that includes all these people in the virtual program, and that you don't have a true sense of what the per 100,000 rate is inside of the physical buildings. So I don't, the dashboard that I have access to, that everyone has access to, just kind of has those cumulative numbers of everybody in the district who's gotten it. You know, they divide it by staff and students, but they don't further divide it down by virtual. I mean, they have a few flags on there that said this was a virtual student, but I'm not sure how consistent those flags are. I'm not sure how clean the data is. All I know is total number of students who've gotten it and total number of students that are in the district. That's what I really know. And I really know, and the same for staff. So yeah, it's the reason they do that. They want as big of a denominator as they can get. They want that 84,000 number because you reduce the rate of error as you have a bigger pool to test. But again, if those populations aren't consistent within, you can see why a lot of people in the community have an issue with how that's calculated.
Sure. Yeah. And, you know, and since this is beyond the headlines, we might as well give you a peek a little bit behind the curtain. Anna and I are both people who really love data. We probably half our conversations end up revolving around data at some point. You know, we don't claim to be, you know, the expert on it, but, you know, we understand there's a lot of different ways to compile data, and not all of them, you know, necessarily return something that is consistent with what you're seeing. And so we've struggled with that as well. You know, certainly when you look at the community as a whole, you have people of all different ages and all different situations. When you look at school systems, you've got big differences between the overall age of the students versus the overall age of the staff. And so it's a constant struggle. So I know we've had those discussions. Anna, there were a couple of questions about the dashboard, you know, including one that was a little open-ended, which is, why isn't there a better dashboard? But can you talk a little bit more about the dashboard that the school system provides, what you can find out from it, what you can't find out from it? And I also know they've had problems with it a couple of times, particularly around the holiday.
Yeah, if you look at Clemson University's dashboard, they include people in quarantine, that is people who have been exposed but not necessarily infected. So they've been quarantined just in case. They have that number. They also have the isolated number. That's the people who they know they've tested positive. So they've been isolated. So you have the quarantine and isolation numbers on the Clemson dashboard. That is not the case on the Greenville County Schools dashboard. They only have the isolation cases, the actual positive test cases on there. And I have asked this district in the past, why don't you include quarantine numbers? And they've basically said, because people confuse quarantine with isolation, that they're afraid that if they go ahead and report out on their dashboard on a daily basis the number of people in quarantine, that it'll look like that many people actually have COVID, when that's not necessarily the case, right? I don't know. I mean, Clemson trusts its people to understand the difference. I think Furman does too. They also report quarantine as well as isolation. Greenville County Schools is less confident about the public's ability to discern those numbers, so they don't report that on their dashboard. They do, however, have it. Burke Royster reports the quarantine numbers at the school board meetings, and so you have a committee of the whole meeting once a month, and you have a full board meeting once a month. And at all of those full get-togethers of the board, he goes ahead and goes over the quarantine number. So I've basically had access to those. I just don't have them in real time, and I don't have them per school necessarily. So that's all stuff that if I asked for it, like if I put in a FOIA request, I'm sure the school would give it to me. But that's what we're always kind of grappling with. When you make a formal request, it's this big process versus just having stuff out there ready for anyone to look at. So it's a give and take in this business. And we would love it if they just put everything on the internet. That would be super nice.
Yeah, we're always a big fan of, just in case anyone doesn't understand the journalist perspective on this, our feeling is if it's open information, it should be truly open and accessible. But not everything is, and certainly some of that comes down to systems and the difficulty in accessing things. And but sometimes it could be simpler than it is. I guess that would be the nicest way to put that. And that is not a shot at the school system. That's everybody has that.
Everybody. My only bias, my single bias, I admit it, is transparency. I will always push for transparency. And some people think it's best to keep some things quiet, but that's not where how I feel about it.
Fairly common stance from a journalist, for sure. And another big thing that it's been a storyline throughout the year, and certainly this is the case with COVID-19 and all the various things that come along with it in general. But let's look at it in terms of the school system, that microcosm. The range of opinions on what is the right thing to do and not the right thing to do has varied widely among parents, other people connected to the school system, people in the community. Can you talk a little bit about some of the varying viewpoints you've seen? I know there was a recent group of parents that put their names to a petition. But I also know prior to the election, there was a group that was very specific about trying to get kids entirely back in school. Can you just talk a little bit about the varying viewpoints and how that may have affected the school year?
Yeah. So I get a lot of really smart parents and stakeholders in general reaching out to me on either end of this issue. And it is really hard to navigate, I'll be honest with you, because the CDC just came out with a study saying that the spread of coronavirus inside of school settings where protocols are in place is very limited. I mean, that's science. And, and so do you believe that the protocols are being sufficiently followed in Greenville County schools? That is such a case by case. There are over 100 facilities, over 100 schools in this district, and I get reports all over the place. My daughter, she's in middle school. She says, Mama, during the class changes, we're all in the hall and we can't keep 6 feet apart. And there's always the wacky-do kid who won't wear his mask. And, I say wacky-do, not because they're crazy, but just because they're being silly or they don't want to follow the rules. That is happening. That's happening every day in every school. So, so if I ask the district, are you following protocols? They're like, we have rules in place. So what I hear from parents is that they are completely scared. Like I'll hear a story of a daughter who's in a class and there's a kid who's just hovering over her all the time without a mask on, and they have to do group work, and that's not cool, right? Stay behind your plexiglass. But then I also hear from parents who talk about the desperate sadness of their children aren't around their friends and need to be in school. Kids who are failing. We've got so many F's in this district, right? So they apparently the school tests, the testing shows that they're learning, they're acquiring knowledge, but there's a lot of F's out there. Kids aren't turning in their work. So there's always that balance. And I am definitely hearing from both sides. Our former president, he wanted 5 days a week. Our governor, he wants 5 days a week. Our current president, he wants 5 days a week. But everybody says open safely. And our school district has said that they are doing that. And it is really hard for one reporter to run out and double check every case. One thing that Terry Brinkman said to me is that by and large, and I don't know if this, I mean, she said when they've gotten reports of kids who are sick who haven't reported it, she has found in general that either the student was quarantined, so this was not a kid who was actually sick. So when you see a clear report on your kid's high school and there's no reports of anyone being sick, you might be confused if a friend of yours is at home, but that person isn't actually sick. There's no positive test, so they're not going to appear on the dashboard, right? So that's been the case sometimes. They've also had it to where the timing was off because somebody reported it, but it didn't trigger into the system for a day or two for whatever reason, or people just missed the cases in the dashboard. So what we're talking about is parents who are saying, "Hey, I know someone was sick in that school, and it's not in the dashboard," and they're she just said, quote unquote, in most cases, this is what has been happening. It's hard to bird dog all that, there have been, I mean, I just counted it up. There have been 2,800 reported student cases, and it's hard to bird dog when you're talking thousands of cases, every single one.
Sure.
Yeah, I hope that answered the question.
As well as you possibly can in 3 minutes. It's we all understand it's a pretty expansive issue. For those of you listening, if you do have information or tips or things I can't recommend enough that you email Anna, A. Mitchell, MITCHELL @postandcourier.com. You can email me as well. We're always happy to hear from folks. We may not always publish what you want to know, but I guarantee you we're in the back checking things out, asking questions, and making sure. So can't recommend enough. Please do reach out to us by email or on social media, either one. Anna, a couple of shorter specific questions that were pre-submitted that I want to get to, and then we'll quickly try to answer a couple of questions over in what's been submitted today. There was a pre-submitted question about teacher vaccinations, and we got some response on that. What do we know on that at this point?
Basically, the state of South Carolina has decided to go with the CDC recommendation, which is to classify teachers as essential workers and to put them in the 1B category for receiving the vaccination. South Carolina is still in 1A as far as vaccination distribution, if you will, or vaccine distribution. And it is an unknown at this point. We keep getting new vaccines approved, and we're hoping to accelerate and we get new doses every day, and we want those teachers at the front of the line. But without a governor saying these teachers ought to be in 1A, there's really nothing you can do. I've got a buddy who's a school teacher up in New York City, and she got her second dose yesterday. So, it varies from state to state. I think 23 states have Ed Week, Education Week, put out a report saying that 23 states have gone ahead and put teachers in the 1A group. We're just not one of them. And this same parent question asked, how is morale? My husband is a teacher in the school district, and he just wears 2 masks and a face shield every single day and tries to keep smiling. But he knows he knows that it's harder to get through to students when you're literally physically covered up like that. And he's a loud talker, but he has to yell pretty loud to get through all the layers of plexiglass and everything. So yeah, I think it makes him sad, but I think that the teachers are doing their best. I mean, I'm talking to my husband. If we ask about how morale in general is, I think there's a lot of upset teachers. I don't know what to say.
Sure. One other question related to special ed. There was a very specific question about special ed students going back full time. What was the district's response on that?
Oh, I have to read it. It was pretty complicated.
Yeah, it was complicated, but since it was such a
Yeah.
specific question, I think we should get to it.
Yeah. It says that the majority of students with disabilities can enroll and be served by the Greenville County Schools virtual program. So the question was, why is it that special education students will have to attend classes in person next year? There's already been a policy put out there that the most profoundly, if you will, disabled kids will need to attend class in person next year, that virtual will not be an option for them. And this parent is like, that's not fair. Why should kids have to go to school if their families deem it unsafe, right? And so again, the statement was the majority of students with disabilities can enroll in and be served by the virtual program next year. This is because the majority of students with disabilities in Greenville County schools receive services that can be accessed through a virtual model. Students, here's the point, students with disabilities that require the most intensive services in the district are often educated the majority of their day through a kind of a self-contained situation. So they're not going to attend math class with all the other kids. They stay in their special education class all day. Students who generally need this level of support require hands-on explicit instruction that typically warrants in-person instruction. So that's what they're saying. They're like, for the most profoundly disabled, that's what they're going with it. But it says, should a child have a medical condition that impacts his or her ability to attend in-person instruction, we encourage the family to speak with the child's physician and consider applying for services through the medical homebound program. So that I have heard that a lot, where parents, families who have a problem with their kid being in school for various reasons, if they talk to the principal, if they talk directly to the district, that solutions can be made. So they have these general policies which make it sound like there's nothing you can do. But if you're, I guess, basically aggressive as a parent and insist, I need this for my child, they typically work with parents. That came up with an excused absence situation where a parent I was talking to, he said, why don't we just call them all excused absences if families feel like they need to keep their kids home during high spread of the disease? And the district ultimately came around to that and said, if you can get, if you are uncomfortable, go speak to your principal and work it out to be an excused absence if you don't want your kid in school during high spread of the disease.
Sure. I think a lot of the questions we've got in Q&A, we have touched on or answered in some way, but one came in, and Anna, I don't know if you have the answer to this, so I'll put you on the spot. Why is the teacher not notified when a student in their class tests positive? You know anything on that one?
Yeah, I've seen it personally. Basically, if you are not exposed, and so what they do is the district does contact tracing. I mean, they swear, right? This is all an invisible process, right? Because I don't know, I've never seen how it works. But what they tell us is that they contact trace, they talk to the student who was infected, and they ask him or her, who have you been around? Have you been in close contact with anyone? And they'll say who they have been in close contact with, and those are the people informed. If the teacher has kept the 6 feet distance and has kept masked up, they don't necessarily tell the teacher. So that's what's going on. I mean, I've gotten 2 emails from my kid's school saying that somebody in my daughter's 6th grade class had was infected, and you'll get a call if she's a close contact. And I never got a call. So
there's this question on here, and I think I can actually answer this one about Dr. Royster stating that DHEC has statutory authority to close schools. They absolutely do. They haven't. That has not been the role DHEC has played, throughout this. I think we covered most of the other things on here. I do think there's one on here in particular that it's important to point out. We're talking about reported cases, not actual cases. That's a really important thing to remember when we're talking about COVID-19 as a whole, not even just education specifically. We have tried to kind of notate that in stories and hedge it on occasion, but depending on which particular health body you listen to, which expert you listen to, the number of actual cases is some level of multiplier higher than reported cases. We know there's lots of people who either get sick and don't go to the doctor, or are asymptomatic and don't realize they've been sick. In particular with COVID, that seems pretty common because of the number of people who either experience little symptoms or minor symptoms. So yes, it's always important to keep in mind that the number of cases is reported, confirmed, tested cases, and certainly doesn't necessarily encompass every person, or in this case, student or teacher or anything else that has had COVID. So certainly something to keep in mind when you look at this data. Again, I think most everything else we have talked about. There are one or two on here that we may need to do a little extra reporting and check on, and we'll try to reach back out to anybody with specific questions. But for now, we're actually out of time, and I can honestly tell you, Anna and I are going to stop this and then go right back to work on the other story, as well as like 2 or 3 other things that have popped up today. It has turned out to be just a very busy day. So again, just want to put in a plug, postandcourier.com/Greenville. You can find all of our Greenville coverage. You can find the app on your phone in both the for Apple and for Android. Just search for Post and Courier Greenville. We are on Twitter. We are on Facebook. If you search for Post and Courier Greenville, you'll find us both there. And by all means, come to our website, click on the newsletters tab and sign up. 3 times a week, I send out a newsletter highlighting the best stories or notable stories that we've done, and letting you in on some information. So if you like this kind of stuff, definitely sign up for the newsletters. You'll get more of it. For now, thank you, Anna Mitchell. We appreciate your time. Thank you to all of you who are out there listening. We appreciate your time, your questions, and we hope to see you on the next one. We haven't decided on the next topic yet, but check back. Sometime in February, we'll be doing another one of these on a different topic. So for now, thanks very much. Have a great day.